We learned today that doctors have been told to discourage patient appointments in order to promote the use of more virtual consultations. New NHS guidance instructs family GPs to embed a system of total triage, meaning that anyone seeking to see their doctor must first have a discussion online or by telephone. It makes clear that anyone deemed by a doctor to require face-to-face consultations should still receive one, but a third of all patient requests can be dealt with using online messaging. Let's speak with Dr. Dan Poulter, Conservative MP for Central Suffolk, also former Health Minister as well. Dan, afternoon to you, sir.
Hello everyone.
Nice to have you with us. I mean, what's going on here? I mean, the right to see your GP face-to-face, sitting in a surgery, it's about as basic as it gets. The health service was built on this very principle, and now it's being taken away from us.
Well, I mean, look, I'm still a practicing doctor, and I have been going in during the COVID pandemic because I work in a hospital, and I would agree that in principle, there are many benefits to seeing patients face to face and looking after them, but there are also benefits to more better use of technology, particularly for people with long-term conditions or people who want to just have a brief correspondence with their GP about a repeat prescription. So yes, it's very often important, particularly with someone who's got a problem. You need to examine them, you need to see them face to face, but we shouldn't we shouldn't force everybody to have face to face consultations when in fact there's some benefit for people with more long-term conditions or for repeat prescriptions to have that more virtual contact, which is good for them in terms of leading their lives, and it also saves the GP time as well.
Yeah, I mean, that does make sense if it's a repeat prescription or something like that. I mean, what would be the point in queuing up, getting into the system, sitting in one of those waiting rooms, reading Woman's Own from 1973 or whatever else is on the coffee table in there? That kind of thing, yeah, that would be a waste of time. But I suppose, Dan, the fear is that people could fall through the cracks here, in that if this is the new order of events, the new normal, that very troubling and worrying sense that people will be put off going to see a GP when there's something more serious. And certain ailments, of course, that can only be done face-to-face, but might not appear like that to begin with.
No, that's absolutely right, and it's crucial that we recognise we're during the COVID pandemic. If someone had a very urgent issue that they needed to be treated about, if they were having, generally speaking, they're having a heart attack or a serious problem, they would then go to A&E. That still happened on the whole during the pandemic. Some people were afraid to attend A&E, but on the whole, I think people still did attend and receive emergency care. I think the virtual system worked well for those people with long-term illnesses who needed a bit of a chat and a bit of a checkup and maybe a bit of a modification to their medications. But for people with potentially something that's a worrying phenomenon, maybe say bleeding when you go to the loo, that kind of thing, it could well be hemorrhoids or something not that serious, but it's something that could be more serious. It's those kinds of things that often a GP is going to need to examine the patient,
sure,
and see them face to face to get a better picture and a better feel for what's going on when deciding whether to refer on for further investigations in hospital. So it's vital that that aspect of GP care is not lost as we continue to maximise benefits for those patients who can benefit from virtual consultations.
Yeah, I mean, I guess the widest question of all of this, Dan, is why? What's the reason for this? Are we overrun? Is it just more convenient and efficient? Is it because of COVID? What would be the overarching purpose of encouraging people not to see their GP?
Well, I think there are two things here. Firstly, it's convenience for some people, because some people, particularly if you're working and you want a repeat prescription, it means you don't have to book out time necessarily, or leave work early, or take time out from family commitments to go and see the GP face to face. So for some people, it's very convenient to do things virtually. And it's also, from a GP's perspective, it can be time efficient, because when we manage those people to some extent with longer term conditions, those people who need repeat prescriptions better via or in a more convenient way. In that respect, it should hopefully lessen the GP workload to allow GPs to do more face-to-face with those who need them. I think the concern is that we don't have a default that all consultations are primarily virtual, when we know that we can free up a lot of time for GPs by doing that virtual consultation for the more routine stuff. But for those people who might have something more sinister going on or who need more urgent help, they can get that face-to-face care, and it's very important that I think that reassurance is given out by the NHS and GPs that they will be there for those important urgent consultations.
Of course. I mean, there is also that other sense, and I know that the GP can't be all things to all people, but certainly from some elderly patients, Dan, we often hear from people who actually quite like the face-to-face thing. There's almost, I don't want to use the word counselling, but there is a sense of that. As a clinician, you'll be aware of that element of, some patients' visits, they just need to see somebody face-to-face. They need that visual reassurance. And to eradicate, and that they might well be the first people that would not get to see the GP because their symptoms aren't possibly that serious, but they just need the visit. I mean, what are we saying to all of those people in this country when you need a smartphone to get any kind of help?
No, that's a very, very fair point. And a lot of older people, are able to use technology, but some are not. Particularly the very elderly, and some people over 80 are quite comfortable with Zoom and smartphones, but some are not. And also, I think the important point here is some of those people do also live alone in isolation, and it's not that the GP should necessarily be seen as a point of contact, but actually it's sometimes important to have that. And my experience, years ago, doing a very limited amount of general practice as a medical student and elsewhere, was sometimes it's that last one or two things that the patient actually raises in the consultation is the real agenda or the real issue they've come to see you. Yeah. So that's much easier to raise those issues face to face sometimes for people than it is to do so over a slightly impersonal Zoom call. What
would be your advice to Matt Hancock here, Dan? I mean, you've been a health minister yourself. You know how that department works. You're a Conservative MP and you're a hospital doctor as well. I mean, you've got more experience of all of this. Is he getting this right? I mean, surely this would come with caveats, a policy like this.
Yeah, and that's right. It's got to become with caveats because, of course, there are going to be advantages to supporting technology. I think if we're looking actually down the track in 4 or 5 years' time, people with long-term conditions, with high blood pressure, with diabetes, actually, if we can have remote, we might be able to better monitor and support those people with remote monitoring by people having taking their blood pressure at home, feeding that information into the GP. There are real advantages to technology here for patients and for doctors and for nurses and healthcare professionals, but it's about not having a blanket policy and a one-size-fits-all thing, because my main concern are for those patients who might have something more sinister, who want to see, that needs face-to-face assessment and physical examination, because, a key part of healthcare, it's not just about listening to what the patient says, that's very crucial,
sure.
But it's sort of eliciting further answers and clarifications. It's about being able to examine them, and we can't have a situation where the push for technology and virtual consultations gets away from delivering good healthcare, which does require those face-to-face aspects of physical examination in a number of cases.
I mean, us talking now on it in a kind of Zoom situation as we are, we can see each other. I mean, you're looking at my face here, Dan. How am I looking, by the way, Doctor?
Well, a lot better than I am at the moment, I think. So
you might have just done a night shift. I don't know.
Well, no, I have been working, but I'm unfortunately calling you on my handheld phone today rather than on a screen. But I think also you do make a very good point that it's not always easy to get a full physical picture of someone over a TV screen or a handheld device.
Well, that's the thing, isn't it? Even the usual thing, like the light in the eye, having a look in my ear. I can get nearer the camera for you if you want. I can open my mouth and say but I don't think that does what you need it to do unless I'm actually there.
Exactly. No, that's absolutely right. And even in my field, I primarily work in mental health. It's you can sometimes get a flavour for how someone's doing if you're talking to them on the phone or on the screen. But it's also very important to see people face to face a lot of the time, particularly if someone is in a mental health crisis, because the way that how well they're looking after themselves, how they're dressed, all those things are an important part of our analysis of what the state of health is. But as you say, you can't examine someone's throat or look in their eyes down a Zoom screen.
Sure. I'm sure Apple are working on the camera, however, that would allow that to happen going forward. Dan, thank you. Lovely to have you on, sir. Dr. Dan Poulter. He's a doctor himself, but he's also a Conservative MP and former health minister, so he's right across many aspects of that. And I think, fair to say, conceding at the end, there will be clearly things you can't do. Eyes, ears, mouth, and that's the obvious stuff. It gets even more personal if that kind of stuff can't be done virtually, which most of it can't. What is the point of this policy? And surely it's the most basic of human rights to go and see your GP. When was the last time you saw yours? 0344 499 1000. It's Ian Collins on Talk Radio.